Hello medicos, we will start with the topic of nose. In nose I will be covering first of all the anatomy and its abnormalities or anomalies present with those structures and disease of the nose. So before moving towards the embryology of a nose, let us have some intro about the nose. Okay, so when we talk about nose, what comes to our mind is nose is a pyramidal structure. You can see here it has pyramidal shape which is present approximately center of your face. And when we see inside the pyramid, we will see here a septum which I have colored it in orange and the lateral wall which is blue. So nose is a pyramid shape structure present in center of your face with a root and the base, in which the root is up. See, this is the root of a nose and it is upwards, and this one is the base, it is downwards. So what we have seen is it is a pyramidal shaped structure with root up and base down. What does nose consist of? See, first of all, feel your nose. Okay, when you feel it, feel your whole nose. When you feel it, you find two type of consistency. The first one is soft and which you can move it easily. The tip of the nose, you can move it easily. Hence, it is suggestive of it is a cartilage. And when we feel the root of the nose, the upper part of the nose, it feels hard and you can't move it. And hence it is bone. So we can conclude that the bone is an osteocartilaginous framework. It is an osteocartilaginous framework. Osteo means bone and cartilaginous means cartilage. Okay, now this osteocartilaginous framework is covered. It has a covering of like this of muscles, different type of muscles and skin. So it is covered by muscles and the skin. Right. Now moving towards the function of nose. See, function of nose is a very primitive thing, but let's just go over it once. It will just warm up your mind. So the main function of the nose is it acts as an airway for when we breathe in and when we breathe out. Okay, so it acts as an airway. It also have receptor for olfaction for smelling things. It has a receptors over there. Okay, I will ask you one question. Your mother is cooking a good dish, and you want to guess it what the dish is. You don't you breathe in, you breathe out. You can say it's good, it's bad, it's smelling bad, it's very good. But to know what this dish is, we sniff like. What is it? What must be the content, whether it's spicy or what does it have? We sniff like. Why do we sniff? My question is to get a proper idea of what the fragrance is. Why do we sniff? Answer this question in the comment section below, and I will give the shout out to the people who gave the correct answer. Okay. The question is, why do we sniff? Why? Okay. Now, moving towards the accessory function of nose. So, when we breathe in and when we breathe out, there are the suspended particles in air, and we can't let suspended particles of foreign body in the air, and we can't let these foreign body enter in our respiratory tract. So, there are some things like some parts or some organs or some things which prevent those entry, and those are hair follicles in vestibule. It traps the larger particles of dust, and the respiratory epithelium, ciliated pseudostratified epithelium, it traps the smaller particles. It also humidify the air. It moisten the air. Also brings the air temperature of air to the body temperature. If it's warm, it will cool it down, and if it's cold or if it's cool, it will warm it up. Okay. Now moving towards the embryology. So see, these are the structure and this is the nasal pit, right? This nasal pit tends to grow medially. Okay, this nasal pit tends to grow medially and also this part is stomatodium. What do you mean by stomatodium? Stomatodium is a name for primitive mouth. Primitive mouth. Okay, these structures tends to grow or invaginate and grows like this. Okay, and we have the primitive streak in between. Okay, so now we have the nasal cavity, primitive streak, and the stomatodium. Right. Now look here. This nasal cavity is upward. It will grow medially. See, I am giving you idea when we have a sagittal section. Okay. When we have a sagittal section, this is a nasal cavity and this is the oral cavity. This is a developed structure. So this nasal cavity and primitive mouth, that is stomatodium, this nasal cavity and the primitive mouth will grow and meet posteriorly here. The nasal cavity and the stomatodium will grow and meet posteriorly here to form the posterior nair. Okay. So let us draw that. You will get a proper idea of it. See, this nasal cavity and the stomatodium meets posteriorly and it has a membrane in it. Okay, in between, and this is the primitive streak, right? Now this nasal cavity get recognized as nasopharynx, right? Nasopharynx, and this as the oropharynx. This as the nasopharynx and this as the oropharynx. And where these two pouches meet, we get a presence of membrane called as, I will write it in blue, bucco-nasal membrane. What? Bucco-nasal membrane. Right. And this thing forms the posterior nair. What? Posterior nair. So what is the other name for posterior nair? It's choana. The other name for posterior nair is choana. Okay, aka choana. It also have this as an anterior nair. Anterior nair means this nostril. It is an anterior nair. And here we have our stomatodium. Right? Okay. So here we get this bucconasal membrane, posterior nair, nasopharynx, oropharynx, stomatodium, anterior nair, and our main, which will be focusing forward, the bucconasal membrane. Now what happens? These pouches merge, okay, and this is a primitive streak, right? And here we have the posterior nair, right? Posterior nair. Now this is the bucconasal membrane. We get a continuous non-obstructed posterior nair when this bucconasal membrane breaks. Okay. Right, when this posterior nair, this bucconasal membrane breaks. At the time of birth, this bucconasal membrane breaks or disappears to form a patent posterior nair. Right? So now we have the patent posterior nair I'm really sorry. It's patent posterior nair, primitive streak, anterior nair, and stomatodium. Okay, now in this embryology, when this bucconasal membrane fails to disappear or this bucconasal membrane is present, we call that anomaly is as choanal atresia. Why choanal atresia? Because it is present in choana, in posterior nair, and atresia, it is not continuous. So we have a name called as choanal atresia. Choanal atresia means the persistence of bucconasal membrane or the failure of breaking of bucconasal membrane. Okay. So, how this choanal atresia presents to you? You are in OT, a baby is born, and how does it presents to you? It presents as respiratory distress, but it has a peculiar presentation. Okay, let us first write it down. It presents as respiratory distress, but of specific type of presentation. So what is this specific type of presentation? It is observed, or you will observe that when a child is crying, he does not show any type of cyanosis and any signs of respiratory distress. But as soon as the child shuts his or her mouth or become quiet, the respiratory distress reappears and cyanosis is seen. Okay, so this is a peculiar or specific presentation of choanal atresia. So what do you see as a presentation? A respiratory distress and a specific type of presentation, that is the cyanosis and respiratory distress disappears when the child is crying and reappears when it is quiet. Okay, so how will you diagnose it? So this type of child is presenting like this and it's done. You need a specific test on that place which will confirm, yeah, this is a case of choanal atresia. So what we'll do, can you guess the thing in the image? Yeah, it is nasogastric tube. Right? It is nasogastric tube. So what we'll do, we'll put this nasogastric tube through your nasal cavity into nasopharynx and into oropharynx. So what will happen is, I will magnify this image. Okay. So as you can see, this tube is passing through, this is nasal cavity. This is nasopharynx and this one is oropharynx. Okay. So what is choanal atresia? When there is a membrane present over here. If the child is normal, we can see that gastric tube in the mouth. As you can see in this picture, see, you can see a tube in this mouth. Can you appreciate this white part? Okay, wait a minute. Can you appreciate this white tube? That is nasogastric tube. Okay. So when the child is normal, you can see this tube like this in its mouth. But when you have a membrane present over here, the tube fails to enter into the oropharynx, or you can't see that tube into the mouth inside. Hence, if there is an absence of tube in the seen through the mouth, there is a properly diagnosed case of choanal atresia. So how will you write it down in the diagnosis? Absence of nasogastric tube in mouth is a diagnosis for choanal atresia, right? Now what will you do for choanal atresia management? You will cut open the membrane. Yeah, it's there. You can do the membrane. You can do the excision of the membrane, but not on that small baby. Your first immediate reaction should be to make that baby breathe. Not going and incising the membrane. You will first make that baby stable. You will make it first breathe. Let its lungs inflaten. Okay. So in this emergency management, we'll do the McGovern's technique. In McGovern's technique, what we'll do, this is the image of feeding nipple. Okay, feeding nipple. So what we'll do in McGovern's technique, we will make a hole over here and put that feeding nipple in the child's mouth. Sorry, the infant's mouth. So why will you do this? Since your nasal cavity is unable to connect with the trachea because of the persistent bucconasal membrane, will make them breathe to the mouth, right? Now tell me one thing, everyone you must have got the sinusitis or rhinitis, the blockage of nose. So you put the feeding nipple with a hole in your mouth. No, you don't do that. We will breathe through mouth because we know that we can breathe through mouth. But baby don't know that. Baby just know that they can only breathe through nose. They have no idea that they can breathe through mouth. Hence it's our work to make them breathe through mouth. Hence this McGovern technique is used to make the baby breathe through mouth. So what we will say, baby is an obligate nasal breathers. What are they? They are the obligate nasal breathers. They only know that they can breathe through nose. They don't know at all that they can breathe through their mouth. But we know. Because whenever we get rhinitis, we get the blockage of nose, we breathe through mouth. We breathe through our mouth. Babies don't know that. Hence they are obligate nasal breathers. So this is an emergency management. What? The McGovern's technique is an emergency management. So there must be a definitive management, or we need to do the definitive management of this case. And the definitive management of this case is excision. Sorry, I'm so sorry, it became white. Excision. So we will cut open the bucconasal membrane and hence we will get a patent posterior nail. But what happens when you create a bare structure in your body, or when you cut that membrane, there can be the fusion of membrane back and there can be the reoccurrence of choanal atresia. Because body has a tendency to heal, body has a tendency to make the fibrotic connections or to fibrose when it's healing. So what happens when those three cut flap heals, they might form the connection and there can be the reoccurrence of choanal atresia. And to reduce the chances of reoccurrence or to stop the reoccurrence of choanal atresia, we will apply mitomycin C. Mitomycin C. Now what is mitomycin C? Mitomycin C is anti-inflammatory. antifibroblastic. What? Antifibroblastic agent, not antifibrotic. Mind the word. Antifibroblastic agent. Okay, and it prevents the fusion of the membranes back and prevents the reappearance or reoccurrence of choanal atresia. Now, whenever there is a case of choanal atresia, mind it, it is not only the case of choanal atresia. Choanal atresia is one of the disease from the syndrome. From the group of disease, choanal atresia is one. So whenever you get a child with choanal atresia at the time of birth, you need to check for some of the diseases and you call it as charge syndrome. You call it as in charge syndrome. Okay, so what are the different types of conditions present in charge syndrome? So charge, C for coloboma of the eye or cranial nerve defect. Okay, H for heart defect, A for choanal atresia we have just seen, and R for growth retardation, G for genitourinary abnormalities, and E for ear abnormalities. Okay, I forgot to cover one point, just let us once go towards the choanal atresia. Okay, so the choanal atresia can be of two types. Where should I write it? Okay, let us write it over here. Choanal atresia can be of two types. One is bony and other is mixed. Okay, 30% of the cases are bony and 70% cases are of mixed. Mixed means bony plus cartilaginous. Okay, this covers whole of the embryology and the abnormalities that can be present. So please subscribe to my channel, hit the like button if you like this video, and comment down below the answer as well as how you felt this video. Thank you.